Good morning to you, Roy.
Good morning, Julia.
Thank you so much for joining us. Like, you and I have been, God, I mean, how many years since I've been on air here at 2016 onwards, we talked about the state of the NHS and the problems, and you've always had lots of very sensible things to say from the spectrum of someone who used to run an NHS Trust chair. Was there anything in Lord Darzi's report today, which only took him 8 weeks? It's amazing. We can't do anything in 8 weeks. You can't get a doctor's letter back in 8 weeks, but he's managed to do this report in 8 weeks. Was there anything in that report that surprised you?
No. And that's why it only took 8 weeks. I mean, really, all of it's well-trodden territory. And as you say, you've been kind enough to invite me on your programme for goodness knows how long now. And I think
I'm virtually stalking you, Roy.
Yeah. Well, you're very welcome. You know, we could have written it probably over a cup of coffee in the canteen. So, no, there's nothing in it. I mean, in fairness to him, it's a well-presented report. It's an easy read. The graphics are good, and there's some new research in it. But there's nothing really new. He's a sensible guy. I've known Darzi for years, really, when he first did robotic surgery. And he's a sensible bloke, and we've got a sensible report. I mean, he actually says himself, the answer is not throwing more revenues into the NHS. It's the dearth of capital investment. And he said, as I have said, and you have said over the years, it's the austerity after the world banking crisis, the Lansley reforms, which were a nightmare, and COVID. I mean, you can add to that the strikes as well, which haven't helped, but he rather tactfully left those out. So, I mean, I think he's done the job. And now, of course, you know, Starmer's talking about it's going to be a 10-year plan. What about the 7.6 million people on the waiting list? What's going to happen to them next week?
Even in the Labour manifesto, they don't say they're going to do anything more than halve the waiting list within 4 or 5 years. So there's not much there. But you say you come back to me in austerity. There's no doubt at all. You know, NHS budget continued to go up in real terms throughout the austerity years. The NHS was one of the few public services that was ring-fenced. We're seeing the playing out in the Home Office and the Criminal Justice Service over the cuts that they saw, and we're seeing the penalties of that over the years. But there's no doubt at all, certainly since those austerity years, we have seen huge sums of money going into the NHS. £165 billion. In real terms, it is a record sum. We're spending more than some other countries in real terms per head of the population who have better health outcomes than us. Why are we spending so much more, but we seem to have, weirdly, a load more staff, but the staff are doing less, achieving less, seeing fewer patients, and we've seen, as in Lord Darzi's words, no progress whatsoever in outcomes for sort of diagnosing cancer early and dealing with some of the key killers in the last few years. Why is that happening?
Well, if you look at what's happened overseas, they consistently invested in their healthcare programs in a period when we didn't. Particularly during COVID, they handled a lot of the in-hospital issues differently as well. So,
well, they didn't do it differently. They did it better. They didn't shut down their entire healthcare system to anyone other than someone with COVID.
They did it differently, and the outcomes were better. Yes, I mean
they did it better, and the outcomes were better.
All right, they did it better. The cancer thing is interesting because there was a time when we were the top of the European League on cancer, and our outcomes and our 5-year survival rates were much higher. But that's collapsed over the years, and now we're really down at the bottom of it. I think Darzi's, says it all really, and it's to repeat the message that we've been saying for so long now. There hasn't been the investment. There's been the problems that we've just been talking about, and as a result of that, all of the outcomes are poorer. I mean, it's not just cancer; it's everything.
It's everything. But this is it. You know, when you talk about investment, okay, so a lot of that will be. I mean, hospitals had a huge amount of investment under the Blair and Brown years, but a lot of that was private finance initiatives. They're still paying for some of those hospitals. People need to have modern hospitals. It helps with, for instance, infection control, things like that. But we also need modern IT. Every time they've come up with some new IT system for the NHS, it's cost billions, and it has failed. They're still using fax machines and pagers, for goodness sake. It's third world level here. In fact, even third world don't use that anymore. What is it that you would do? What is like? Tell me the top 3 things that you would do. If we can identify all the problems, what would you do to actually make it different? Make it better.
I would fix the social care system, which is the big drag.
Fixing the social care, that means paying more money to people in care so they'll work in care.
No, well, yes. I would have a national minimum wage separately for people who work in the care sector, and I would pitch it above the national minimum wage working wage now to get people into that sector, create a proper career structure for them so it's a proper job.
Yeah.
I would do that. I mean, I think that's really very important.
So that will stop particularly elderly people going into hospital who wouldn't otherwise need to, but also if they do go into hospital, they'll be able to leave more quickly to go into care.
Yes.
So that frees up a huge, 20% of beds probably?
Yes, 13% on most days and a lot more. So, yes, I mean, I'd get that fixed. Secondly, I would sort the workforce issues out. Some of the working conditions are pretty poor, so I would impose a standard set of minimum working conditions for all trusts.
What does that mean?
Well, I mean, for a lot of hospitals, for example, evenings and nights and weekends, there's no access to any canteen facilities. There's always argy-bargies over parking problems. Yeah. There's difficulties with creche facilities, and predominantly the NHS is a female employer. And so the creche and care... I mean, when I ran a hospital, I had a creche in my hospital.
And they're particularly affected because, of course, they work odd shifts, unsociable hours. You just simply can't get those facilities.
Most creches open at 7 in the morning and close at 5 o'clock, which is useless if you're doing straight. So, those sort of basic things. Yeah. And then I think, really, moving on from there, we have to get back into the territory of IT. Now, I'm not talking about the big IT. I mean, the last big IT failure was a Labour failure. Care.net was, as it was called. But simply, I mean, the systems don't speak to each other, which is a pretty easy thing to fix. Yeah. The logins, I mean, you can take 10 minutes to log in on a ward, and if you see a patient, log in, do the thing, go back, see another one, you've got to log in again. Yeah. I mean, these things are pretty simple. So it's not huge, artificial intelligence investment I'm talking about. It's simple, basic IT to make it work.
We don't need Elon Musk to do it. So, I mean, I would agree with all those, but I would also add in the bureaucracy, just the extraordinarily slow... paper-pushing bureaucracy, which means that patients turn up for appointments, paperwork isn't there, so they can't actually be seen by the doctor.
Julia, part of the IT piece. You can fix that with barcoding. Amazon run their industry, their huge international industry, with barcodes. Yeah. We do exactly the same thing.
I've been saying, genuinely, I've been saying the last few weeks, I would get someone who's been in charge of running something like Tesco to come and sort out the NHS, because I think they'd be able to make it work. The logistics of it. Oh, really good to talk to you, Roy Lilley. We'll see what happens. I have a funny feeling we'll be bothering you again. Roy Lilley, former NHS Trust chairman.